A very good evening. I'm Lamba coming to you from a remote location in New York City. Welcome to Wednesday's Vision of Asia South Asian News segment. This is our ongoing report on the coronavirus pandemic. Today, more than 5.5 million cases globally of COVID-19 with at least 350,000 deaths happen in the world. In the United States, nearly 100,000 people have died from the novel coronavirus with almost 1.7 million cases. New York, where we are coming from, remains the hardest hit state with at least 363,000 cases, with New Jersey second hardest hit state, followed by Illinois and California. As we speak, the United States is reopening across the nation with concerns of new cases trending upwards in states of Georgia, Arkansas, California, and Alabama. We again urge all of you to continue practicing social distancing and stay safe and healthy. Take precautions, especially if you are in areas that are reopening. Today, top infectious disease expert Dr. Anthony Fauci cautioned that a resurgence in COVID-19 cases after reopening may not happen right away because the effect of the spread will not show for a few weeks, and again urged all to be careful and follow state guidelines. Dr. Fauci also urged the nation to wear masks in public and protect ourselves and others around us. If you are a South Asian healthcare worker or have an essential business running during this coronavirus pandemic, do reach us on events@itvgold.com with your story, your experience, and your advice for our audience. Also, a shout out tonight for all frontline workers, medical professionals, and all nonprofits that are truly working consistently to help all that are in need. Much tonight on the developments in the novel coronavirus, featuring top South Asian doctors, along with our exclusive featuring Bollywood singer Shibani Kashyap. Here are the headlines. Dr. Purvi Parikh on COVID-19 updates and inflammatory syndrome in children, New York City. ITV Gold exclusive featuring Indian playback singer Shibani Kashyap on COVID-19 relief efforts in India. Dr. Deena Adimoolam addresses South Asian community on coronavirus impact and diabetes, New York City. Time for a short break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Lamba, and this is Vision of Asia, special report on the coronavirus pandemic measures and updates. Businesses across the country are now opening doors after shuttering in mid-March as states and local governments took drastic measures to slow the spread of COVID-19. The disease almost brought the country to a halt, with at least 21.4 million Americans losing their jobs. However, 20 states are now reporting an increase in new cases since reopening, and top officials are again cautioning all on continuing social distancing and taking all precautions to ensure safety. What is going to be the impact of this reopening on healthcare, and where are we in New York City with the curve of this disease? We spoke with Dr. Deena Adimoolam, who provided much insight on developments of the novel coronavirus and urged all to practice social distancing. Dr. Adimoolam also gave her take on South Asians with diabetes and other high-risk disease and its interactions with COVID-19. Here is the story.
And in terms of then building immunity and nutrition and also just working on your wellness, how do you sort of, suggest we all do that?
So I think it's really important to pay attention to all those things that you mentioned, Aditi. And often we forget about it. I kind of group everything together as self-care. Taking care of yourself and putting yourself first, making sure that your mind is healthy and making sure that your body is healthy. So when it comes to your immunity, I think it's really important to make sure that you're getting enough rest, to make sure that you're sleeping properly through the night, which can often be, very hard during these times. Making sure that you're getting in the right nutrition. I've been telling a lot of people to try to incorporate lots of foods that have more vitamin C and vitamin D, because we know that those vitamins are really important for the immune system. So that's definitely one way of sort of combating against COVID-19 or any other type of infection if it comes your way. Making sure that you're taking time to exercise. If you do have a medical condition, making sure that you're taking your medications to keep that under control. So for someone with diabetes, that would mean making sure you're taking your diabetes medications and make sure that you're watching your blood sugar, that it's controlled and it's not going very high. All of those things are important in terms of self-care. When it comes to mental health, I think it's really important to be aware of the fact that you may be having all these underlying stressors that are affecting your psyche. Making sure that you're aware of the stress around you. And I think that's really hard for a lot of people to identify, the fact that stress is in their lives. But some of the way that you would know that is you might be having difficulty sleeping. You might be having some changes in your mood. You're more depressed. You're more anxious. Your heart is beating fast for no reason at all. You're having panic attacks. All of these things could suggest that you have some underlying depression or anxiety, in which case it's important to seek help and make sure that you see a doctor or see a therapist to sort of oversee any of these issues. I think it's also really important during this time to really stay connected, to make sure that you're keeping in touch with family, with friends. A lot of my friends are quarantining by themselves. They don't have any outlet in their own homes, and they find themselves socially isolated, and socially isolating themselves means that they're getting depressed. They're feeling alone. They feel that they don't have any hope. And I think it's important then to find somebody that you can connect with, whether that's a friend or a family. I think one of the things we've learned, from this pandemic is how small the world can be by using technology, by using video chat and cell phone and Zoom. All of these things just make our world a little smaller and allow us all to connect with each other in a different way. So try to connect with people, try to be involved socially with some interaction. I think that's absolutely very important.
This entire journey is basically something that the entire medical community had never imagined that they'd have to go through. And it's something that's very personal to all of you because you're really, truly the frontline heroes. How has this entire experience, changed healthcare or just looking at patient care for you? And also, how has it changed your personal life and how you have to interact with your own family members and your own kids?
So this pandemic has absolutely changed all of our lives. It's changed our lives in the hospital. It's changed our lives, doing everything that we would do day to day. I think this is all just a new normal. It's a way that we're going to have to live until we have a better option in place, like a vaccination that can really protect us. And so, for me, I actually have a 2-year-old at home. And, it's really hard. It was really hard for me to even think about going into the hospital, seeing patients, or, being present in a place where COVID is very obvious, like a hospital setting, and coming home to my child. So I'm just really trying the best that I can to keep safe. So what I do is I have my own routine for when I'm coming home. I make sure that I'm sanitizing all my doorknobs. I sanitize my cell phone. I take a bath as soon as I come home because I've been around hospital patients, and I make sure that I wash all of my clothes right away. I do all of the things that I can to try to keep my family safe in the best way possible. That's the only way that I can live right now, moving forward. I have a lot of colleagues that actually sent their family away. They're living away from their family. We didn't have the luxury of doing that because we have elderly parents. And so we didn't want to put our family at risk too for potential, COVID infection. So we decided that we're just going to do this in isolation from our families. And that's another, concept that's been very hard, is staying away from our parents. My child is the first grandson. Everyone wants to spend time with him. Everyone wants to hug him and kiss him and hold him. And unfortunately, they can't right now. And it's probably the hardest thing for them because they find so much support in they find so much support and stress reduction in just spending time with family, spending time with their grandson, and they can't. So we're trying to do everything to limit our exposure to our family. We don't get to see them as often as we would like, and if we do, it's very limited interaction, wearing a mask. We're 12 feet away from them at times. We have to keep further distance because our son will run to them otherwise. So it's really a different way of living and being right now, and it's a new normal. It's a new normal until this passes, and I think I won't feel comfortable until I know I have some degree of protection against this virus.
We spoke with infectious disease expert Dr. Purvi Parikh, who joined us virtually for a discussion on the coronavirus updates, vaccine trials, and her take on a rare inflammatory syndrome in children. This syndrome is being connected to the novel virus, putting many concerned parents on the edge. Health experts say that it is similar to the Kawasaki disease, with a rare condition with unknown causes that affects children of various age groups and causes inflammation in the blood vessels. Bringing her expertise, Dr. Parikh advised parents on this new condition being seen in children across the nation and also what to watch out for. She also urged all to continue practicing social distancing and showcased concern for an increase in cases across the nation due to reopening. Here is Dr. Purvi Parikh.
And is there a concern for newborn children? There have been a lot of, investigations also being done on the impact of COVID-19 on pregnancy. What have been your key findings, and what could you tell us about that?
Right. So newborns in general are at an increased risk for all infections because their immune systems are still developing, especially if they are born early or premature. So, in all newborns, we have to be extra careful. In fact, we don't even let certain visitors come see babies unless they've all had their vaccines and whatnot, because we just don't want that child to be infected. And there's a lot of vaccines and things they can't get, that young. So in general, they are more at risk. So they need to be carefully watched, protected, limit contact with many individuals if possible. Now for pregnancy, we don't have good information yet. So we don't know what it means if like the mom has COVID-19, what will happen to the baby. Now there are pregnant women who have gotten sick with COVID-19 and had babies. And so far, everything is going well. We haven't seen what we call transmission from mom to the baby. So that's good news. So there's no way that your baby inside of your belly can get it if you are sick with it. But, once the baby is born, anything is possible. They can catch any virus.
In terms of this inflammatory syndrome that we're talking about, Dr. Parikh, do you predict or do you anticipate this to be a really major concern for the nation? Just a few weeks ago, we were talking about just a couple of these cases, but now we're talking about a few hundreds of these cases. How should we sort of understand this?
Right. I think the main takeaway is that, our initial thought about children being, more resilient to this virus or more immune to this virus, it's not that it's wrong, but still overall kids are doing well. But it might mean that we need to be more careful in how we reopen schools when that time comes, because the children aren't as protected as we thought they were. So I think that will be the biggest takeaway, that one, we have to be careful about looking for it. And now we have to be even more careful about reopening schools. And that might change when we reopen, how we reopen, as we learn more about this.
What's your advice to parents? What could they do to perhaps build immunity and, nutrition and wellness in their children?
Right. So, I get this question a lot, and there's no magic pill, for immunity boosting or nutrition boosting. The most important thing, which I know is difficult to do in times like this when there's a lot of stress that you're out of your routine, but the most important thing is eating a well-balanced, nutritious meal, avoiding junk food, processed food. All of those things are really bad for your immune system. And then getting enough sleep, getting enough fluids, hydration, and exercise too. So I know many people are stuck at home, but it's really important to make those efforts, because that can go a long way for your immune system. And there are certain, vitamins that do help, but you can get those in your daily multivitamin. You don't have to take mega doses of anything. But in general, vitamin C, zinc, vitamin D, like dog, is very good for your immune system. But again, it's not about a magic pill, because if you're not doing those lifestyle things, no amount of vitamins or pills will help.
Dr. Parikh, what is your focus for the next few weeks now? Now that the curve is, it's flattening, we're seeing some decline number of cases. What is your focus?
Right. So, our focus is mostly looking at, the safest way for us to reopen. I've been seeing patients throughout, but it's been at a much limited scale because we don't want to expose people unnecessarily, but at the same time we do want to be there for certain patients who have emergencies so that they don't end up in the ER or the hospital. So we have to take those things into account from a professional level. I'm also looking to see what happens with the numbers in general, or in New York, in New Jersey, in the US, because that will tell us what's going to happen in terms of any new surges coming or second waves coming. And then I don't know if you knew this, but I'm involved with some of the vaccine trials. So
Wow.
I'm hoping as we get, more information there, I mean, that will take much more time, unfortunately, but I'm hoping it makes me feel good that hopefully we're moving towards something that can protect all of us, at least, by end of the year or beginning of next year.
Could you give us a little insight into this vaccine trial if you're allowed to speak on it?
Yeah, I mean, can't give too many details, but we are doing multiple trials at NYU. One is industry-sponsored trial with Pfizer, and again, we're studying the COVID-19 vaccine, the mRNA vaccine, and then also, I'm sure everybody has heard of the Moderna trial
Yes.
that the NIH has partnered with. So, in a couple of months, we hopefully will be enrolling many patients for that trial too, because we're trying to see as quickly as possible how safe and effective it is. So let's see. I mean, I don't have any new information other than that, but at least the good news is that people are trying, and many different institutions are trying to get good data fast, so we can decide what is safe and effective.
Today, actually, the top health officials in the US said that there could be a vaccine possible by December. Any comments on that?
Yeah, I mean, if there is one possible by December, that's extremely good news. The problem with vaccine studies in general is they take time, and rightfully so, because we want to, one, make sure something works, and we want to make sure it works for a long time. You don't want a vaccine that will only last a couple of weeks. And two, you want to make sure that it's safe. So we want to make sure that, whatever that we're giving people doesn't have too many side effects. And so far, the results are pretty promising. Even from the Moderna study, it's only 8 patients, but overall it seems safe. And it also seems like they're getting a good immune response that hopefully seems to be working against the virus. But, only time will tell. The other problem is too, your immune system doesn't work overnight. So if I get a vaccine today, it will take me a couple of weeks before I can make those antibodies to fight the virus. So again, it takes time. It takes a lot of people being enrolled, because we want to test it in all sorts of people and with all different backgrounds and ages. So that's why it takes a long time. But December, I think, would be great, but we need to be ready in case it takes longer than that, because that's another possibility.
It's time for a short break on Vision of Asia, Voice of the Community. Come back to us. Welcome back. This is Vision of Asia Coronavirus Pandemic Special Report, and I am Aditi Lamba. We have now another segment of our ITV Gold exclusive featuring Indian playback singer Shibani Kashyap on COVID-19 relief efforts in India. The popular singer has been doing many digital concerts and performances to raise awareness and funds for numerous charities and non-profits for COVID-19 relief. Discussing the plight of low-wage migrant workers and underserved communities that have been impacted the most due to India's lockdown, Shibani discussed the importance of artists in the music community right now in utilizing this platform of music to help the most vulnerable that are in need. She also urged the South Asian American community to do their part and give back during this pandemic to their motherland. Here is the Indian playback singer Shibani Kashyap.
Talk to me about this strength, all the artists are showing through music in raising funds, especially with your experience. You worked with particular fundraisers that are raising money directly for COVID relief. You also did a song, Corona Ko Hai Harana.
Yeah.
Well, and it's a beautiful song. It was just all positive spirits. How does that process work? For artists such as you, and if there's a nonprofit aspect to it, and then there's a music aspect to it.
So we're in tough times, and I think we all need to be together, by staying apart, and together as a unified fraternity to do things for each other. So recently, there's a band called Astitva. So they created a song called Hum Saath Hain, and they featured a lot of artists, including me, Akhil Sachdeva, Palash Sen, Nitin Malik of Parikrama Band. These are very well-known musicians of India. So we all got together to do this song, and we sent our vocals on just our gadgets, on our phones. And because we don't have access to studios,
Right.
And the music producer got all our vocals, made the music, mixed, mastered, created the track, after which they wanted a video also, obviously. So we just shot the video in our own respective homes, gardens, terraces, whatever space that we could find to actually make it look as pretty as possible. And the one person who's actually stuck by me to help me out in all of this, who I couldn't have done without, is my husband. He is a techie savvy guy, and he's been framing all my frames and shooting me.
Yes.
So I mean, obviously I can't shoot myself, right? So so he's been doing all the camera work and everything. And he also conceptualized the video, the Corona Ko Hai Harana video. He's the one who actually made the video, and our editor Abhishek Sharma did the whole editing with, creating 4 Shibanis in one frame and all of those things. So it was quite interesting. So we're learning as we're going along, actually, about this situation.
It's a great song. I like it. I really like it. And I know it has definitely connected with your audience and your fans as well. Talk to us a little bit about some of the projects that kind of hit home for you, for these COVID relief efforts, the concerts you've done. What are some of the charities that you're currently working with that we should know about?
So there is something called Feed My City. So what they do is you can just donate anything. And so they created a concert with lots of artists. And during that concert, of course, that there is you can actually subscribe to that channel, and you can actually donate on the spot while watching the concert. And those proceeds go towards all the, the daily wage earners, the people who've been worst hit by the lockdown. The laborers, the migrant workers, the daily wage earners, so who really don't know where to go. They're just moving around they're going astray, and they have no money, they have no food. The poor, the homeless, who at this time are even more homeless. So it was very important to first do something for them, and so that's why I jumped in and I did this concert. And so this was one of the fundraisers. Then there is an NGO called Anything Will Do. So it just literally means anything will do means, like, even if you give 20 rupees, 200 rupees, whatever, just so that they can feed people every day. So whatever we have been doing, whatever money which has been coming, it's not just about the money, it's about donating. You can just go feed them also, feed the people. So I also created a concert on the Facebook page of Anything Will Do, where I performed, and I reiterated that please donate generously. Anything. It doesn't have to be just money. It could be food. You could just give them maybe sanitizers. You can give them something that can help their life, because they can't afford it.
Even masks.
Maybe medicines. Yeah, even masks. Anything. So a lot of people have been taking a lot of initiative by distributing food and masks and sanitizers, and doing free testing for these people. So there are things happening, but of course we're still up with a huge challenge. We don't really know what this is and how it's going to go, and only once the vaccine comes in. And so we have to live in the COVID times, and we have to start being very, very careful, take our precautions. But I think this situation has made everybody very humane. That's all I can say. People have become very humane. On the 31st of May, there is a concert called One India Concert, which I'm going to be a part of. Now, this concert is for the event industry per se. So the people who've really, really taken a huge hit in our industry are the event organizers. So that's how they were earning money, by doing events. And there are no events happening, and I don't see events happening for a long time, for at least a year, because people are scared. No large gatherings or public gatherings are going to happen. So these people are also very badly hit, because they have no income anymore. So we are going to do this concert to raise funds for the event industry people. And also there's another concert which is going to be jointly for, of course, the corona victims, and also the recent cyclone and the floods which came in, Calcutta, as in Bengal, West Bengal. So it's called Goonj. The whole concert is called Goonj. I'm going to be a part of that also. That is happening on the 30th of May. So there is a lot which is happening, and I'm glad people are taking initiatives, and I'm glad I'm a part of all these things. I can do something.
दूरियां बढ़ाना, नजदीकियां घटाना, social distancing, बार बार hand washing, social distancing, बार बार hand washing करते रहना, कोरोना को है हराना, डर को भगाना, कोरोना को है हराना, डर को भगाना।
कार में ना घूमो यूं बाहर तुम, औरों के बारे में सोचो तुम जरा सा, ये बेवकूफी और ना अब झेली जाएगी, पुलिस तुमको यूं ही डंडा लगाएगी।
Go Corona go, go go Corona go,
कोरोना को कोरोना को
go Corona go, go Corona go, go Corona go, go Corona go.
And that is all for tonight's episode. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from a remote location in New York City. This is Vision of Asia. I am Aditi Lamba. Take care and be well.